Today we can discuss the topic that is what means pharmacology of Haemopoietic system. In pharmacology of Haemopoietic system, another topic is fibrinolytic. Fibrinolytic system. The process of dissolution of clot is called fibrinolysis. When a clot is formed, an inactive plasma enzyme present in blood called plasminogen, it is incorporated into the clot. Endothelial cells of most tissues then secrete tissue plasminogen active, that is TPA, which is released into the blood and reaches the site of damage. That is, TPA is activated and form a clot. The TPA in turn TPA in turn activates plasminogen to plasmin, an active enzyme that digests fibrin into fibrin degraded products. Okay, why we need a fibrinolysis? Because it provides check and balances the clotting process so that it should not go out of hand for minor reasons in day-to-day life. Sorry. It dissolves clot at the site of damage once the damage is repaired. The activity of TPA is blocked by or checked by plasminogen activator, it is inhibitor 1 and plasminogen activator inhibitor 2, so that circulating plasminogen may not get activated. So it is a very important one and you can understand cleanly. As compared to arterial thrombi, venous thrombi are lysed more easily by fibrinolytic. The reason thrombi are lysed better by fibrinolytics than older ones. Mechanism of action. What is the mechanism of action here I want to discuss here means inactive as such, but combines with the circulating plasminogen to form an activator complex which limitedly proteolyzes other plasminogen to plasmin. So it is a positive feedback mechanism for fibrinolytic, that is plasminogen to plasmin. In antifibrinolytic it is a negative feedback mechanism. What is the example for fibrinolytic? Streptokinase, urokinase and alteplase. For antifibrinolytic, what is the example means epaconic acid, tranexamic acid and epirotonium. Okay, for fibrinolytic, it is used to lyse the thrombi and also clot to recanalize the occluded blood vessels, mainly coronary artery, especially work by activating the fibrinolytic system. What are the various drugs used in the treatment for fibrinolytic means? You know, I think in India it is a very popular place that is for the purpose of drug purchasing. That is Surat. That is S means streptokinase, U means urokinase, R means retaplase, A means alteplase, T means tenetoclase. So easy to remember. The Surat you can remember. What is meant by streptokinase? It is obtained from beta hemolytic streptococci, binds with circulating plasminogen to form a complex that activates plasminogen to plasmin. The T off is 30 to 80 minutes. And also it is antigenic, also pyrogenic. It is destroyed by circulating anti-streptococcal antibodies. And also sometimes it may lead to hypotension as well as arrhythmia can occur. Why it is repeated dose of streptokinase should be avoided means there is antistreptase, that is unisolated plasminogen streptokinase activator complex. The complex consists of purified human plasminogen. That's why you cannot administer repeated dose. Very important. The anti-streptococcal antibodies which may present due to previous infection may destroy streptokinase. So initial loading may be required. Antigenic and can cause hypersensitive reactions and anaphylaxis, especially when used for second time. So want to go for a second time, it leads to some problem may occur. Repeated doses are also less effective due to neutralization by antibodies. Uses. It is used in the treatment for acute myocardial infarction. That is 7.5 to 15 lakh international units, and as was used in the by IV over 1 hour period. Deep vein thrombosis, and also pulmonary embolism. Adverse effect was bleeding, hypotension, allergic reactions, fever, arrhythmias may occur. Contraindication, recent trauma, surgery, abortion, stroke, severe hypertension, peptic ulcer, bleeding disorders, it is contraindicated. Next drug is urokinase. It is an enzyme isolated from human urine. Now it is prepared from cultural human kidney cells and also direct plasminogen activator. Very important one. It is a direct plasminogen activator. That is the reason it activates the plasminogen directly. The dose was 2.5 lakh international unit intravenous over 10 minutes followed by 5 lakh international unit over next 16 minutes. Its T-off was 10 to 15 minutes, non-antigenic and non-allergenic. Fever can occur, but hypotension rare. That is the reasons compared with the streptokinase, urokinase can be used for the treatment for fibrinolytic. It indicated in patients in whom streptokinase has been for a earlier episode. Okay, alteplase. It is a recombinant tissue plasminogen activator. That means RTPA. It is selectively activates plasminogen bound to fibrin. It is non-antigenic, not destroyed by antibodies, rapid acting, more potent, superior in dissolving cold clots. And also short half-life, 4 to 8 minutes only. Nausea, mild hypotension, fever may occur, but is somewhat expensive. That is the reason why means it is prepared by DNA recombinant technology using human tissue culture. Dose was 15 milligram IV bolus and 15 milligram over 30 minutes, then 35 milligram over next hour. You want to administer regularly. Newer recombinant tissue plasminogen activator, that is retaplase, that is modified RTPA, longer half-life 15 to 20 minutes, but less specific for fibrin-bound plasminogen. But retaplase is less specific for fibrinogen-bound plasminogen. Retaplase dose was 10 milligram over 10 minutes, repeated after half hour. Clinical efficacy is risk of bleeding same for all the patients. Tenecteplase, genetically engineered mutant for form for alteplase, higher fibrin selectivity and longer half-life. That is 2 hours. Single bolus dose 0.5 mg per kg sufficient, but is very expensive. What are the various uses of fibrinolytic? There is acute myocardial infarction, recanalization into 50 to 90% cases alternative first-line therapy to PTCA. There is heparin, aspirin started concurrently, and soon after thrombolytics, there is fibrinolytic prevent reocclusion. Next uses is deep vein thrombosis in leg, pelvis, shoulder, up to 60% successful, can reduce pain, swelling, and also preserve venous walls. Main advantage, and maybe a reduced risk of pulmonary embolism. Pulmonary embolism, third use, that is indicated in large life-threatening pulmonary embolism. The lung function may be better preserved, but reduction in mortality is not established. Peripheral arterial occlusion. Recall is 40% of limb occlusion, especially those treated within 72 hours. However, indicated only when surgical thrombectomy is not possible. And final one is ischemic stroke. So these are the uses of fibrinolytics. Thank you for your patience, students. Thanks once again.